Hello to Dr. Asung Joseph and my fellow classmates. So today I'll be doing a presentation on depression that's based on my infographic, which contains the definition of depression, the types, the symptoms, the treatment process, and the current statistics. So what exactly is depression? You see, depression is a very general term for several different types of mental illness or mental disorder in which a person is has persistent feelings of sadness and sometimes coupled with anxiety, and it is a medical illness that influences how a person feels, whereby they feel more negative thoughts when bad things happen to them, and they feel and their reaction to simple things can be more than a normal person's reaction. And the way one thinks, which is when they're alone, what they think about, they usually think negative thoughts when they're alone. And of course, the actions of a person. See, a depressed person would not act the same way as a mentally stable person would. As the term itself suggests, they are depressed and they have all these negative thoughts. So the mental disorder is treatable with several different types of medicines and um, methods, all based on how severe or minor your depression is. Because as you see, depression can be categorized from minor depression to severe depression. There are many different types of depression. So, who are the victims of depression? As you can see, anyone can be the victim of depression, whether it be your neighbor, your family members, your classmates, even some guy that you pass on the street. Anyone can have depression, really, because 246 million adults worldwide, that's not a small number. That's a very large number. And it is a serious illness that cannot be taken lightly. Many things that can come out from having mental illnesses such as depression and anxiety. So, why do people get depression? Generally, depression does not result from a single event, but it's a combination of recent and other long term or personal factors. As you know, there's in the personal factors, you can have a family history, which is depression can run in families, which is also part of the genes. See, it can be passed down. Some people who, let's say, their parents have depression, they're more at risk of getting depression because it'll be in their genetics. However, having a parent or a friend who, or a close relative, sorry, not friend, with depression doesn't mean that you automatically have the same experience. Life circumstances and other personal factors are still likely to play a huge influence. So, other than that, there's also the personality of a person. See, some people may be more at risk of depression because of their personality. It's how they carry themselves, how they act. Because you see, people who have a tendency to worry a lot, to have low self-esteem, they are perfectionists and they're self-critical, they're negative. These are the people who really are at risk of having long-term depression. So you see, this is serious medical illness. So the stress and worry of coping with a serious medical illness. See, some people who have serious medical illnesses, they might be more susceptible to these kind of things. You see, because the stress and worry itself of having a mental illness can lead to depression. Means from one situation where you have, let's say, cancer, you worry about your cancer spreading and how are you going to pay the medical bill. So you end up from having only cancer, you get depression as well because you overthink and you're anxious about what's going to happen to you and or your body. So there are changes in hormones from medicine, and as we know, medicine is also a drug. So drugs and alcohol use can both lead to and result from depression. Many people with depression also have drug and alcohol abuse problems, you see, because in a study in Australia, over 500,000 will experience depression and substance use disorder at the same time at some point in their life. So moving on to genes, this is like what I said just now. It can be passed down from your parents because there are some types of depression that tend to run in families. Genes, they are the blueprint for who we are, and we inherit them from our parents, as you know. So scientists right now, they are looking for genes that specific genes that may be involved in depression, because as we know, people who have parents or close relatives that had mental illnesses are more susceptible to these mental illnesses as well. So lastly, we have environmental and environmental factors, which is trauma or the stress of a loved one, a difficult relationship, and other stresses. They can trigger these types of depression. Scientists are still working out to figure out why depression occurs in some people, but not in others with the same or similar experiences. They're also studying why people recover quickly from depression and others do not. So basically, when we talk about environment and psychological factors, we're talking about what happened or is happening in your life. For some people, it can be a factor in getting depression, but for some people, they see it as a small thing and they don't get depression from this. It varies from person to person. Okay, so these are the some types of depression, which are the major depressive disorder, which is when someone experiences persistent and intense feelings of sadness for extended periods of time, let's say for 2-3 months, let's say. And then there's the psychotic depression, which is a subtype of the major depression I was talking about just now, in which some depressive illnesses, they can form, which includes psychosis. You see, psychosis can include hallucinations, delusions, feeling of worthlessness, or feeling some other type of break with reality. So next, we have the persistent depressive disorder. You see, persistent depressive disorder is also similar to major depressive disorder, but it lasts for a longer time. Let's say if major depressive disorder, it lasts for 2 months. The persistent depressive disorder, it can last for 2 years in a row with no break whatsoever. And then we have the seasonal affective disorder, also known as SAD, which is SAD. It is a type of depression that relates to changes in seasons. You see, at the beginning or at the end, about the same time every year, a person might get sad might get depressed because of the seasons. And we have postpartum depression, which is a type of depression that is suffered by a mother following childbirth, typically arising from a combination of hormonal changes, psychological changes, adjustment to motherhood, and fatigue. It's also called postnatal depression. This is common amongst new mothers, especially because the anxiety of having a newborn child, this is your first child, they might not be ready for the experience, and there's a lot of feelings of worry and persistent anxiety, so they might experience postpartum depression. Lastly, we have situational depression, also known as adjustment disorder with depressed mood, which occurs when a person develops certain emotional symptoms that are more exaggerated than normal in response to a stressful life situation within 3 months of the situation occurring. So let's say you get fired from your job, and because of that, you get depressed. That is situational depression because you've been worrying about your job. So within 3 months of from getting fired, you get situational depression. Okay, so the general symptoms of depression are weight loss or gain, being tired without energy, difficulty thinking, concentrating, or making decisions, an increase in purposeless physical activity, and slow movement or speech. It's okay. So next we have, what are the treatment options? So firstly, we have psychotherapy, which is talking to a professional in the form of a psychiatrist or a therapist. It may help a person manage and cope with these negative feelings inside themselves. As psychiatrists and therapists, they are taught on how to handle people with depressive episodes. And then we have medication. You see, taking medication in order to treat the symptoms of depression can be done if a licensed professional healthcare provider prescribes antidepressants, anti-anxiety pills, or antipsychotic medication. Each type of medicine used has its benefits and potential risks. Of course, if you take the medicines, you'd have to contact a professional like a therapist or a psychiatrist just now, and basically they know what to prescribe someone who has a specific type of mental disorder. And then we have taking care of yourself. You see, in order for any form of treatment to be fully effective, you must also take care of yourself. You can't expect only therapists and psychiatrists and medicine to help you. Treatment starts with you. So you must improve by getting enough rest, taking a healthy diet, avoiding negative people, and finding activities that you find enjoyable in general. And lastly, we have exercise. See, a mere 30 minutes of exercise a day can improve your mental health, mental state, and mental health. Exercise can increase a hormone which the brain produces, which are called endorphins. You see, endorphins drastically improve a person's mood. Endorphins are produced when you feel very happy, when you've done a task that makes you satisfied. And when you exercise, these same hormones are released, which can really improve one's mood and feel much better about their outlook on life. So these statistics, as we know, 8 to 12% of Malaysians suffer from depression. The number of teenagers have been rapidly increasing. The number of teenagers who suffer from depression have been rapidly increasing over the years. And the B40 in Malaysia, which is not surprising as they are the lowest tax bracket in Malaysia and they have the lowest amount of income, are among the highest number of depressed in Malaysia. The COVID-19 pandemic has caused an influx in the number of depressed adults and teenagers. You see, because COVID-19, which I'll be talking in my next slide, is a very tricky issue to handle. Many people have suffered from COVID-19, and the people who stay behind and watch as their family members die and get sick, this will cause a very sad moment in their life, and they will possibly get depressed. So depression in COVID-19. Okay, so the COVID-19 pandemic and the resulting economic recession, they've negatively affected many people's mental health and created new barriers for people already suffering from mental illness. So the cases of depression, they've only increased since the start of these movement control orders, lockdowns, the national emergency. The lockdowns in Malaysia have directly increased the number of cases of depression. You see, experts suggest maybe because of the coping mechanisms used. During these lockdowns, many people are worried and stressed over the coronavirus, their family members getting COVID, they themselves are trying to avoid COVID. Even when your food comes, you don't know if the food panda or the Grab food driver has COVID. So they tend to worry and stress out. And as the pandemic wears on, ongoing and necessary public health measures expose many people to experiencing situations linked to poor mental health, isolation, job loss, all these sorts of things. Young adults have experienced a number of pandemic-related consequences, which are like closures of universities, the loss of income. This can all contribute to poor mental health because the closure of universities only makes it more stressful for students as they have to stay at home and do their assignments and they have to attend online class, which can only lead to more stress because online class is not the same as a physical class, whereby online classes, sometimes your internet connection might be slow, you might not get what the lecturer is saying. And basically, young adults are very at risk of depression thanks to this COVID-19 pandemic. So many essential workers also are at risk of getting depression, of suffering from depression. You see, as they face challenges which include greater risk of contracting the coronavirus from other workers and even their patients compared to non-essential workers, essential workers are more likely to have depression and substance use and suicidal thoughts during this pandemic. So if you know someone with severe or minor depression even, you just have to advise them, tell them how you feel about them, tell them what they can, what they can't do, and maybe you'll make them feel better about having this depression, because it's not something that they can change. It's not something that depression is not something that they can change within themselves. They need an outside opinion, and you can ask them to seek for professional help. Don't let them ignore their mental issues. And if they're feeling like they want to commit suicide, they can always call the suicide hotline and try to calm them down by talking about their problems. Make sure they're calm before you bring them anywhere, and that they accept that they are depressed. So, in conclusion, depression is a very serious mental issue that we need to handle with. Okay, so in conclusion, depression is a very serious mental health issue that needs to be taken seriously by the government, people, family members, friends, anyone, so that we can avoid from people having suicidal thoughts, anxiety, depression. These are all very serious issues. And basically, if we help one another, then we can help to avoid people from getting depression. So I believe that based on all these facts and the information in my infographic, that we will be able to spread awareness to people who don't know much about depression and they want to know, because depression is a very serious issue and it cannot be avoided no matter what. We need to help people with depression at all costs, because they are the people who are most at risk of suicide, self-harm, and all sorts of negative impacts. And lastly, for anyone out there who's watching this video, if you know anyone with any form of mental illness like depression, don't just ignore them. Please help them out and let them know what to do. As you've learned in this video, there are many things that you can do, and there are many things that the person who is depressed can do. So please help out your friends, family, or even any stranger that you know that might reach out for help. Thank you very much.